communities and how we plan on restoring everyday life over the next several months through the governor's Restore Illinois plan. Before we start, Kathy and I, as I mentioned, have some opening comments, including the fact that, speaking for our communities and for everybody involved in this call and in our city government, we are all collectively horrified at the actions and behavior that occurred in the Minneapolis, with the Minneapolis policeman and George Floyd. It's a shocking and awful event, and it points to a larger issue that we need to do a better job of addressing in our country. And but I think also, we're very collectively concerned about the civil unrest. There's been a lot of media postings. There are stores in Market Square tonight that are boarded up. Many of you know that there is a planned peaceful vigil tomorrow night, scheduled for Market Square to end, around 8:30. We have been receiving some cooperation from the planners, who are a group of Lake Forest High School graduates. And but I want to make one thing very clear: the city of Lake Forest is not sanctioning this event. We were not told about it. We discovered it, and have been working with the organizers to manage it as best we can. And as far as it was already happening on social media with a fair amount of publicity, which was how we found out about it. We were never asked to participate. We have managed to manage it a bit, and we have taken a lot of precautions, not all of which I can speak of tonight. But our police force is very well connected. Our Lake Bluff partners are very well connected. We have regional connections, statewide connections, county connections, and national connections. And we believe this will be a successful, quiet demonstration, as has happened in other North Shore communities over the last few days.
Well, George, as you know, and as everyone should know, the protest movement is for meaningful change, has been going on for various years and all sorts of things. We support the right of all of our citizens. It's a constitutional right to peaceably assemble and peaceably put out their message. And we will continue to do so. For an example, yesterday, we had a small group of residents from the North Chicago area come down to our village green and were out there and were waving signs and protesting in a very peaceable manner. Our police chief, by the way, who's the former Lake Forest police chief, went up and talked to them, and I went up and talked to them. They were extremely polite, they were extremely respectful, and our citizens of Lake Bluff were extremely respectful. They were there for about an hour, and then they left. That is going to happen, and we will always do our best to put the side of what is civil and what is appropriate, and we think that will work. George?
And a couple of things. One, I'd like to caution all residents about social media. Much of what is published on social media is simply untrue. And before engaging in long strings of conversation about it, verifying facts is important. And there has been a lot of untrue communication, a lot of I'll call it alarmist communication, and in many cases, this is all based on facts that are simply not facts. So we are monitoring it. We will let you know if there's anything that the citizens need to be concerned about. but moving on from that for a moment, as you can tell here, the city of Lake Forest and the village of Lake Bluff have been great partners since they were both founded in the 1800s. Tonight's meeting is sort of a welcoming to the longstanding collaboration between our communities and between representatives of Lake Forest Hospital, Lake Forest College, the school districts, and so we all work together. We meet periodically. A little story. This has been going on for about 50 years. The group is unofficially known as the I Can't group because most of the time the meetings have to be rescheduled because somebody says I can't make it. But it still carries on, and it's been a very helpful collaboration between our two communities and between the major institutions that exist within our communities, as I said, for 50 years. With that, I'm going to turn it over to Kathy for some additional comments.
Well, this is interesting, and I can't help but always try to put it in historical perspective. I think this is the first time that, not that we've collaborated, we have done that through a variety of things, but this is the first time that I think we have brought not only the municipalities together and the school district together, but and the college, and also our chief health presider in this interesting venue that we have in today's world. But we have collaborated for a long time. We share our high school. We share a chamber of commerce. We have numerous intergovernmental agreements between our municipalities. So we're used to working collaboratively together. And I think that will certainly continue. One of the things I do want to mention is that it's really important for us to find a balance as we move forward here, a balance between trying to reemerge our businesses and get back to a certain semblance of normalcy as we now are entering into phase 3, and also to maintain the balance of health and safety for our residents. And that is an ongoing thing of which we monitor constantly. But things are changing, and we're happy to see that. I mean, we're having a first farmers market this year. That'll be coming up this Friday. Our beaches are now open. You now can do a foursome for golf. We have tennis, and tennis is open, and paddle tennis are all open. So all of these things are reemerging for us. So we are making attempts. It's like peeling back the onion. We are really trying to move ahead while also understanding that the health and safety is paramount for all of us here. One of the issues that I think that we're talking about is how do we get that economic situation under control for us? We are providing an economic stimulus for our businesses. It's a one-time thing for those that have had at least a 25% cut in their revenues because of the COVID. We've done that. We've made changes in our liquor laws to allow for outside seating arrangements with that. So we've closed off part of Scranton Avenue to allow for outdoor seating. So, we've done that. We've also had to cancel most of our events for this summer, as is Lake Forest, including our famous 4th of July. And
Right.
Also our 125th anniversary, which we were so looking forward party that was coming up in September. But we have rescheduled all for next year, as I'm sure as Lake Forest has done too. So we're looking forward to that. That's what we are looking ahead for. The reality of it is that this COVID has taken an economic toll on us. And it's likely going to be felt for years. 1/3 of our village revenue is derived from sales tax. And while our Heinens and Target revenues are on target, so to speak, they are fine. Our car sales, which is the greatest piece of our sales revenues, is quite low in the first and second quarter, which is certainly of great concern for us, and we're monitoring that. So as we relook at our budgets and we're reevaluating our revenues and reevaluating our expenses so that we can make sure that we can maintain a really positive outlook for our citizens in terms of a solid financial stability for us now and in the future. I think, George, you want to talk a little bit about our distinguished panelists?
Yeah, I'm gonna make a couple of quick comments before I do that, because Kathy, you touched on a few things that are important. You know, in addition to the fact that our beaches open and looking great, we've got the city offices back open again. For most of our city buildings are open again. Interesting, we had a program. We had a program during the lockdown where people could bring all their recycled material that they would normally have had to take to the recycling center. They could just leave it at the curb and we would pick it up and do that for free. That was enormously popular. But when we reopened the recycling center this past Saturday and Sunday, we still had over 1,200 cars come through, and that's a 50% increase over last year. So there are some pent-up demand items out there, but you know, we're making great strides at opening up. And if any of you have had a chance to go into town and sit outside and at any of the many restaurants that have outside seating now that the weather's a little better than it was over the weekend, that's very enjoyable. So as Kathy mentioned, we are reopening as quickly as possible and trying to reimagine whatever we can to continue to have a lively summer. So that concludes my sort of updates. I'd like to introduce our guests. The way we're going to do this, we're going to have a quick medical update from the Lake Forest Hospital President Tom McAfee and Chief Medical Officer and Senior Vice President Jeffrey Copen. And then there's going to be a sort of conversational question and answer session with, in addition, Stephen Scott, President of Lake Forest College, Jason Wisha, Lake Forest City Manager, Drew Irvin, Lake Bluff Village Manager, or Village Administrator, I guess, Michael Simic, Superintendent of Lake Forest District 67 and 115, and Jean Sophie, Superintendent of Lake Bluff Elementary School 65. With that, I will now introduce our leadership team from Lake Forest, Northwestern Memorial Lake Forest Hospital. I still have a hard time getting that out, for a quick update on the medical front.
Well,
So,
thank you, Mayor Pandolfino. I am really delighted to be here with Dr. Copen to brief you on exactly how we are responding to this this scourge on our community and on our country and on the world. I have to say, it's interesting when I think about being a proud member of the ICANT group, and it was something unique that I was introduced by the previous president of Lake Forest Hospital, and he in turn had been introduced by the president before him. And so this legacy goes back 50 years. And I was thinking about the history of the hospital. And it's interesting because as I think about the foundation of Lake Forest Hospital, as many of you know, it was started as Alice Home in the east side of Lake Forest, where on the campus of what is now the Lake Forest College. And Alice Home was built in 1901. And in fact, around 19 months following construction, interestingly, pandemics or infectious disease actually hit the community in Chicago, and in a similar fashion consumed many of the beds of the new Alice Home. And typhoid and measles, mumps, rubella were among a few of the diseases that were ravishing the country at the time. And in fact, so much so that there needed to be the construction of a contagious hospital in addition to Alice Home to support the demand. So, you know, past is indeed prologue. And, you know, 100 years ago or 120 years ago, we responded, and obviously a lot has changed. But what hasn't changed is the fact that pathogens in our lives. They will continue to be. In fact, you know, 100 years from now, I wouldn't be surprised if there's another bug, if we're lucky, that'll bring us, the community and the world together again to fight it once again with the next iteration. The severe respiratory acute syndrome coronavirus 2, or COVID-19, is a severe respiratory illness that has really been, it's unbelievably impacted not only Northwestern, but obviously all of us. I could tell you that we began to see the presence of this bug in middle of March. And it's unbelievable to see how the organization has come together to react to make sure that we are in a position to care for what we anticipated to be a significant influx of patients. Remember, this is a novel virus, so we knew nothing much about it other than what we saw in Europe and New York, and what we saw was terrifying. You know, the nice part about being part of Northwestern, or being Northwestern, is that we have 30,000 employees, 5,000 physicians, and 10 hospitals, and the capability of the most advanced academic and scientific capabilities in, you know, and amongst the country. And I can tell you that we brought them all to the fore to help battle this. We rapidly responded by making sure that this hospital was positioned to accommodate the demand that we anticipated. We engaged our analytics team to begin to go through the surge planning process. We rapidly reduced our schedules for elective procedures and procedures that could be delayed. And we focused our energies on accommodating what we knew was going to be a significant increase in our patient load. And sure enough, it did occur. We expanded our emergency room greatly. And in fact, the new hospital, I think that you should be proud to know that the years that were spent in planning and designing this facility, I have to say that although we weren't planning for it to accommodate the demands of a pandemic, that's exactly what it's done. For those that are familiar with the hospital, the first floor of the institution is what we call the Granger Interventional Platform. It's a series of about 74 treatment spaces that are designed to support many of the outpatient procedures and supporting what occurs in our operating platform and our diagnostic platform. We were able to use those to be able to rapidly expand the capacity of the institution to support this increase in demand. So although running typically around 120 beds, although our occupancy has been very high since we've opened, we could rapidly increase that multiple fold to support the demand. At the peak, we saw around, at any given day, around 68, close to 70 patients in-house. We also had around 35 ICU patients. We did expand our ICU, in fact, tripled the size of our ICU during this experience. To date, we have had 453 discharges from Lake Forest Hospital. To put that in context, downtown, our sister hospital, Northwestern Memorial, has seen 951 discharges over that same period of time. Those that know the two hospitals and their relative scale know that that's a pretty heavy load on Lake Forest. Northwestern Memorial is probably about 7 or 8 times the size. So to take half the volume, we took a significant share. And I could tell you that that volume has continued to decline, although we are far from confident that this is anywhere close to being behind us. Many people don't know that Lake County is ranked, I think, the 7th or 8th, Jeff would know this, in the country behind the East Coast or Greater New York hospital counties. So when you think about 3,000 counties, the burden of COVID in Lake County has been pretty significant. We also know that many of you have seen what you witnessed in New York, which again was more than distressing. It was distressing for us because we didn't know what to expect. But I can tell you that leveraging the resources of Northwestern, we're able to use our logistics team to access, and to be honest, I'm still perplexed on how they managed to do this, but they made sure that we had access to the necessary beds, the ventilators, the personal protective equipment to make sure that our staff was safe. Never in any instance were we in a situation where we didn't have more than adequate supplies for our staff, which was obviously enormously valuable. And I have to tell you that that PP&E has truly saved lives and has protected our staff and our greater community. In fact, we've shared many of our PPE with our nursing home partners, our federally qualified health centers and the like. Our vast network of academic and science resources, leveraging their relationships with their colleagues in Europe and in New York, were allowing us to change on the fly how we were managing these patients. We applied the best in practice with therapeutics, and I can tell you that the outcomes from our statistics are amongst the best in the world. So you should feel really good that if you were to have to come to this institution for someone you loved or know, you could be rest assured that the care that they receive here is amongst the best in the world. Our innovation team also rapidly responded. As you know, we had limitations on the availability of testing equipment, medium for the specimens, even the nasopharyngeal probes. We actually used the resources of Northwestern University and the system to actually fabricate that material and make it so that we could provide that testing capability right here for us. And we worked as a unified team. So what I can tell you that is, despite the fear that is out there, I can tell you that statistically, and Dr. Copen will get into this in more detail, that 95% of the patients that present to Lake Forest Hospital have survived this disease. Again, amongst the best statistics and outcomes in the country. All the while, by the way, having some of the best patient experience statistics that we've had as well, ironically. In fact, I can tell you that when a patient gets discharged from our nursing units, there's actually a bit of a celebration with clapping and cheering as that patient is rolled out the front door after they've successfully gone through the trauma associated with this disease. We never are at risk for our ventilation capabilities. Our hospitals, our intensivists, our physicians, nurses, technicians, the support staff have been phenomenal. And I can tell you that they have worked tirelessly. This has done some damage to our community in a big way. I could tell you that it started in Lake Forest. It didn't hit us nearly as bad. We had a lot of the resources to take care of the social distancing and the requirements to keep each other safe. We also learned rapidly, but unfortunately it did move up into Waukegan. And the density of the population, the high hardship that exists there hit the community pretty significantly. You probably may not be aware that around 55, I think at the top, around 56% of the patients that were going through and testing came back positive with COVID. So an enormous impact on that patient population. And the 3 hospitals that cared for the county's population, predominantly Vista, Lake Forest, and Condell, stepped up and have managed. We've worked closely with the health department and collaborated tightly. So I can tell you that we do see the impact on the communities of high hardship and its impact on their health. We see it, they're in the ICU today. But I can tell you that they're receiving the best care, and we at Northwestern will continue to step up and provide that care and continue to make sure that everyone, regardless of their ability to pay, is cared for well at this institution. The volume today has stepped down, as I said, significantly. We're down to around 35 patients as we speak. About 5 of those are in the ICU. But I can tell you that I feel incredible pride with what's been delivered to our community, and I hope you do too. Many of you have stepped up to help, and for that I have to say we're eternally thankful. The resources, we've had 10,000 meals contributed to our staff. The cards, we had a parade by the EMS first responders around the hospital. I can tell you that the support to the staff has been phenomenal and incredibly appreciated. So on behalf of the hospital, thank you for stepping up and supporting us. We have incredible resources at Northwestern. If you want to continue to support the hospital, you can go to nm.org. There's ways to do that. We continue to have needs for our patients and our community, and I'd hope you continue to keep us in your mind as we continue to battle this. The unfortunate situation with Mr. Floyd and its impact is the last thing that we needed at this time, but I can tell you that we too, as a community and a hospital, will come together and do our part to make our complete county and our region better together. So with that, what I'd like to do is also finally tell you that this is a safe place to come to receive your care. We've worked through the surge of cases. Volume has stepped down significantly. We have put in all of the best of science to make sure that patients that present to this hospital that need their medical care come back and are treated safely. We've instituted many of those assurances so that you could feel safe in coming back. It's important that people come back to the hospital for a variety of reasons. We've seen a significant reduction in heart attacks and strokes presenting to our emergency room, congestive heart failure. We know these diseases continue to exist in the community. And if people delay in receiving that care, it actually could be at the expense of their health and the health of our community. So please feel comfortable to know that our hospital is well prepared, and we'll make sure that you're safe when you receive your care. So that's what I wanted to convey. I'd like to now turn this presentation over to Dr. Copen, who is the Chief Medical Officer for Northwestern Medicine and is my partner in making sure that we all get the best of care. Jeff, take it from here.
Yeah, thanks, Tom. I want to, first of all, start by saying good evening to everybody. And on behalf of our medical staff, our Chief of Staff, Dr. Jill Holden, our wonderful nurses led by Denise Majeski, and the whole hospital staff, thank you for the support that we've received from our community. It's been outstanding. It's been just inspiring for all of us. Tom already shared with you that Lake County, Illinois was particularly hard hit by the COVID-19 plague. We really are the 7th most prevalent county outside of the greater New York area when it comes to cases of COVID. Not a distinction that we want to have. But here's the amazing news. No one knew it. There was no sense of emergency here. There was no sense of concern that we were going to run out of space. We had the capacity, and we worked very closely with Vista and Condell to see to it that we can take care of our entire community, the community of Lake County. Now, it's been 3 months since we started to work on the COVID situation. It's hard to believe, because I think you all will agree, it doesn't feel like 3 months, right? It feels more like 3 years. COVID time is really bizarre. But it's only 3 months since we started to work on this. And we now know so much more than what we knew when this started. So to start off with, how do we get this? This is really important to understand. First thing we now know is that being in enclosed spaces, the inability to physically distance from other people, places like congregate living facilities, that would be like a nursing home, a homeless shelter, a sheltered living facility, a prison. Places where people can't physically distance, and also people who live in small dwellings with lots of people. That's a big risk factor. Who also gets this? People who are severely ill. Older people, people with chronic medical conditions, things like heart disease, hypertension, high blood pressure, chronic kidney disease, people who are immunosuppressed from things like cancer, people are getting cancer chemotherapy. Now, even with this, and I can't stress this enough, Tom already mentioned it, 95% of individuals admitted to this hospital with COVID. And remember, people who are admitted to the hospital only make up 5 to 7% of the total population of people who are infected with COVID. These are the sickest of the sick who actually get admitted here. And of those people, we've now admitted 510 people altogether. 95% literally walked out of here. 95%. I cannot say enough that being admitted to the hospital with a diagnosis of COVID-19 is not a death sentence. People have to understand this. It is not a death sentence. We can take care of our patients who have this disease. Now, we do that even without an effective treatment. Unlike a bacterial infection where we have antibiotics, as of today, there is not yet an effective antiviral medication. Everyone has heard of remdesivir, I'm sure. It's gotten a lot of publicity over the last 2 weeks. We actually were part of the trial that showed that remdesivir does have some impact on individuals who are infected with COVID-19. We continue to be part of a trial looking at the overall effectiveness of this medication, and we are hoping, and I have to stress hoping, that remdesivir really will show and be proven to be making a difference. We don't know yet. But other than that, what we figured out is how to properly provide supportive care to our patients, trying to keep our patients from going on ventilators. We figured out that simple things like having our patients lie on their stomach, we call that proning, rather than lying on their back, is incredibly effective in helping a patient's lungs provide the amount of oxygen it takes to support that person's body. We're very proud of the proning protocols that we created and that our amazing nursing staff has been able to use on our sickest COVID patients. Our community should be incredibly proud of this hospital's wonderful staff. All right, so now, as of last Friday, Governor Pritzker announced that we entered phase 3 of reopening Illinois. So how do we proceed with our lives now that we're in phase 3? The single most important thing I can tell our community is use common sense. And what do I mean by that? After our 3 months of COVID education, every one of us is actually an expert when it comes to COVID. We all know the 3 most important things: physical distancing, the use of masks when we leave our home, and frequent hand washing. 3 simple things: physical distancing, using masks when we leave our home, and hand washing. These things really work. And there's an underlying science to this. We now know that the way that the virus spreads is through the exhaled breath of an individual who is infected with the virus. The viral spread occurs through exhaled breath. The second thing that's important is the amount of virus that's in that breath. We call that the viral load. And the third thing is how much time is a non-infected individual exposed to that viral load. And in all of these things, less is best. So how does that translate into our lives? Well, number one, being outside is better than being inside. Avoiding a cramped, poorly ventilated room or building is very, very important. And being in a big crowd is not a good idea. All of that goes back to the virus being in exhaled breath. So let's translate that into day-to-day considerations. We have beautiful beaches in our communities. It's okay to go to the beach, it's safe, but not if it's too crowded. Don't go to a concert. I don't think we're going to have those. But even an outdoor concert where many people are jammed together, that's unsafe. It's okay to patronize our amazing restaurants, but if the tables are too close, just leave. Physical distancing is critical in that situation. Our churches and places of worship are about to open, the same thing. Physical distancing in masks, critically important. No singing and no loud voices. Singing and loud voices propel the virus even further. If you're in a church, people aren't wearing masks, leave. God will forgive you. God will praise you, as will Dr. Copen. Now, those of us who have kids, teenagers, is it okay for them to get together with their friends? It is. It is. And by the way, try to keep them now that the weather is nice from getting together with their friends. It's impossible. They might not even wear masks the way that we want them to. Let's be realistic. And you know what? It's probably okay, Because what we now know after 3 months is kids, 99% plus, do just fine, even if they're infected. The problem is it potentially can bring that to grandma. So just keep that in mind. If your teenagers are out together and you have elderly parents, if there's immunocompromised, chronically ill people around, those teenagers have got to stay away from those folks. Now, let's take all of this and boil it down for each one of us. Each one of us has to assess our own individual risk. This is the key part of all of this. Those of us who are older, those of us who have chronic medical issues, that's a totally separate set of risks than for somebody who is young and healthy. An 85-year-old resident of Lake Forest has a very different set of considerations than that person's 24-year-old healthy grandson. Again, common sense. Therefore, some of us will happily go out to eat. Others of us will do carry out or delivery and eat at home. Some of us might decide that we're going to take an airplane, a commercial jet, and we're going to fly to get a few days away. That might be okay. But other people might decide that they're not going to get on a plane for the foreseeable future. Each individual has to assess his or her risk. I'm asked frequently about antibody testing. It's available and it's fine, but let's be clear about what a positive antibody test means. It simply means that individual has had a prior infection with COVID-19. That's it. It doesn't say anything about immunity. All this talk about immunity passports, whatever you want to call it, is way premature. And it doesn't say anything about whether a person can contract the virus again. We just don't know. Therefore, if you get tested and you're positive, you have the antibody, that's great, but you still need to observe COVID precautions. Although the summer is just starting, I want to talk about the fall. This is critically important for the health of the public and each individual. When we start offering flu shots, everyone should get one. Everyone needs to get an influenza vaccination this fall. We're going to work together with the health department and the other health systems in the area and all of our community partners. We want to get as many people immunized against the seasonal flu as possible. The symptoms of the flu and the symptoms of COVID are very similar. It's difficult for us to distinguish one from the other. Let's do everything we can to prevent prevent influenza when we get into the fall. And speaking of vaccines, I myself am not optimistic that we're going to have a viable COVID vaccine by the winter. I really hope I'm proved wrong. You should know that there are brilliant people around the world who are very well resourced, working, using brand new technology to come up with an effective COVID vaccine. I hope we have one soon, but I don't expect one by the winter. And the final message, to reiterate what Tom said, Northwestern Lake Forest Hospital is open for your care and it is safe to come here. Please do not put off necessary medical care. Please do not put off necessary surgery and other diagnostic procedures. It is safe here. We have taken all the proper precautions. Your personal physician can explain more if necessary, or you could go to our website, nm.org, where we go into great detail about the precautions that we take. So please, if necessary, come see us. I wish everyone health and safety, and thank you for your time.
Well, George, this might be a good time for us to sincerely thank our first responders, our essential workers, our teachers, all the other educators, and everyone who has really come to the forefront during this pandemic and during this crisis. And we want to thank everybody very much. I want to certainly thank Northwestern Lake Forest Hospital for everything they have done as a pillar of this community. Virgil.
Yes, absolutely. And I can say, our in Lake Forest, our police, our fire, our EMS, who work, all three of them work in close collaboration with the hospital and put themselves at risk every time they come in contact with a member of the public. And they've been extraordinary. Their morale was excellent. They adapted and they kept us safe. And I want to make a general comment that I've made before about Lake Forest Hospital, Northwestern Memorial Lake Forest Hospital. I've said many times, Lake Forest is a city full of treasures, and frankly, I can't think of maybe the beach ranks up with Lake Forest, Northwestern Hospital. And to go as we did, what was it, only 3 or 4 years ago, from a almost 100-year-old unattached or unaffiliated community hospital to being a part of the Northwestern Memorial system with a brand new building, which, Tom's the only guy who keeps this number in his head. He's never actually committed it to me, but I am told it was something on the order of $500 million that's been invested in that hospital. To have that as part of a community of 20,000, or if you include Lake Bluff, maybe 26 or 27,000 people, right in our midst, with the connections that they have to the global medical community, and the stature that they have in the world, and the technology that they have for a community of our size, absolutely extraordinary, and a huge gift and a great anchor of quality for the future of the city. And we really thank Tom for your leadership. I know you were there before, during, and after the acquisition, and before, during, and after the new hospital being built, and you deserve a great deal of credit for bringing Lake Forest into the absolute cutting edge of medical care right here in our small town. And Lake Bluff obviously is just as close and it benefits just as much. So we really are incredibly proud and thankful that you're here. And it doesn't, all those things you said about what the hospital was able to accomplish. First of all, having the new facility obviously made a huge difference, but it didn't surprise me. I mean, it's just the way you guys operate. So thank you so much for being a pillar of our community. At this point, we're going to turn it over to questions from the community, which we've been receiving right along here. So I'm going to start with asking the first question, which is really about sort of Lake Forest and Lake Bluff financials. How are we doing? Kathy mentioned a little bit about sales tax revenue, but I think I'm going to let Drew Irvin and Jason Wisha say a few things about our financial situations.
Drew, you want to go first?
Sure. Again, hey, I wanted to thank also Tom and Dr. Copen. Great information. Thank you so much for everything you guys have been doing. To answer the question specifically, I would say, let me first say Lake Bluff is, we're in a very robust financial situation, very fortunate to be where we're at. I will say, as Village President O'Hara noted, Lake Bluff, about 1/3 of our revenue stream is sales tax. That's good news and that's bad news. I like to look at more of the good news. It is the Lake Bluff over the years had been able to diversify our revenue stream largely through land use decisions, which has brought a new stream of revenue into the community that was not there. We used to be really solely dependent on property taxes and some other state shared revenues to fund all of our activities, including our capital initiatives. But now we have sales tax dollars that are driving and funding a great amount of capital investment. But certainly the COVID-19 pandemic has interrupted that revenue stream. And I think we're thinking at this point of expecting about a 25% downturn right now. This is something that we're watching closely, and that's the sales tax, what we're expecting to lose from the COVID-19. But again, it's something that we're constantly looking at and And again, we're very fortunate to start off, and we were actually hitting strides in terms of all-time highs in sales tax walking into the COVID. So that was good news in some regards, but I think the village is positioned well to navigate this, and we are meeting regularly. In fact, as soon as Monday night, to continue the conversation at a finance committee level about looking at our expenditures and reprioritizing our capital initiatives and seeing how we might tweak that, again, depending on what information we get and as our crystal ball gets clearer. Jason?
Great. Thank you, Drew. And, I'll echo part of those comments and just acknowledging that while Lake Forest certainly is also impacted by the pandemic from a financial perspective, we really are also very uniquely positioned to weather this storm without adversely impacting our ability to provide services to the community. And I think first and foremost, we benefit from being a community that has had a historical commitment to conservative financial planning with emphasis on long-term horizons. Being good stewards of taxpayer dollars is really a hallmark of Lake Forest city government. And so we're very fortunate to have robust reserves and rainy day funds for exactly times such as these. And really, I would just acknowledge that's a testament to city council and staff that have come before us. Again, it is a hallmark of our city government. And so we're well positioned. We also, a little differently than Lake Bluff, but we're fortunate to benefit from a revenue structure that is reliant on consumer-driven revenue sources. And those are the revenue sources, as we've discussed, that are most directly impacted by the pandemic. We've certainly forecasted some material impacts to our general fund, our Parks and Rec fund, and our golf course fund. We have frozen a few personnel vacancies in an effort to reduce expenses. In addition, the city council chose to defer a stormwater improvement project until next summer, just so we could have a better sense of the true financial impact as we move further into our fiscal year. But all in all, I will say that, while we continue to monitor the impacts of the pandemic on the city's finances, and I would note to the public that includes monthly updates and presentations to the city council, so please tune into our council meetings. Nonetheless, we remain a remarkably strong financial position, and that really allows us the luxury and the opportunity to be deliberate in making any adjustments to potential revenue disruption without having to make any reaction decisions.
All right. Well, I'll take the next one, George. And I'm going to ask our medical professionals this question. How can we move forward with guidance decisions that make community protection from virus transmission and reducing the number of deaths our priority? For example, there is conflicting evidence on the effectiveness of masks and face covering. Gentlemen, could you respond to those?
Jeff, why don't you take that one?
Yeah. All right, start with the final part, masks. I would just say that there's conflicting evidence on everything when it comes to COVID. It's been with us for exactly 3 months. Whenever anybody talks about the science, we don't have a lot of science yet. We're developing it. We got a ways to go. But masks, I'm pretty confident about for reasons that I already said. Exhaled breath, viral load, the amount of time we're exposed to it. So when you're with other people in confined spaces, please wear a mask. In terms of cutting down on the number of deaths, here in Lake County, we've had really an unfortunate thing happen. Fully 2/3 of the people who've died from COVID were residents of nursing homes. 2/3. When the history of COVID is written, one of the great early failures will be the failure to protect the nursing homes. We just didn't do it. We didn't do it early enough. There were some fundamental errors that were made. The good news is we've hardened the defenses at the nursing homes. We're proud of the fact that Northwestern Lake Forest Hospital, we provided PPE, protective equipment, to a number of the nursing homes, and we taught them how to use it, which they didn't know how to do. They're now adept at this. The nursing homes know what to do now to protect their residents. So I think we'll do far better now with nursing homes. I think if we do that, that's 2/3 of the deaths. So follow the simple things, use common sense, and we'll keep the fatality rate down to a low rate.
Jeff, could you speak to the effectiveness of our PPE at Northwestern and Lake Forest?
Yeah, one of the really wonderful developments, I'm sure everybody recalls that we heard from Northern Italy that many of their medical professionals were getting ill and dying from COVID. They had over 1,000 fatalities of frontline healthcare workers. New York had dozens of people who got sick and died. So when this started, we didn't know what to expect. And to say that we were concerned is an understatement. But having proper PPE, following our safety protocols, after caring now for over 500 patients, and I always hate to say this because I don't want to change where we are right now, I have yet to have a single physician develop symptomatic COVID, and only 2 of our frontline nurses have gotten sick. Both of them went home, recovered, and are back to work fully healthy. That's it. Over 500 patients. Use the PPE correctly, follow our safety protocols, and we can do this.
Thank you. The next question is, you touched on this a bit before, but a resident asked, how many cases of COVID-19 have been reported in Lake Forest and Lake Bluff of school-age children between 5 and 18? Of those reported, how many resulted in fatalities? And if there were any fatalities, how many of those children had underlying health issues?
All right, the second part's easy. We haven't had a single fatality, not one. The number of small children or kids under the age of 18 who've died from this, I believe we can pretty much count on the fingers of our hands. We have had some kids that have been hospitalized. You've all read about the multi-system inflammatory viral process, but the kids aren't dying either. We can treat that. So not a single child from Lake Forest or Lake Bluff has died. How many have been infected with this? It's of the people who've been tested, it's just about a dozen in the community. That's it. So that doesn't mean that there haven't been more kids who have actually been infected. We don't know because they haven't been tested because they've been asymptomatic. So again, the message is COVID is scary, but our kids are going to do fine.
Great, thank you.
All right, well, let's throw this next one at our educators, particularly President Shute of the college. What is college going to look like in the fall?
Thanks very much, President O'Hara and Mayor Pantaleon and everybody involved in this tonight for making this possible. I think it's been very informative for everybody listening. So I'll just say, quick reminder, 3 months ago, although as Dr. Coben said, it feels like a lot longer, 3 months ago, we had to turn on a dime and send everybody home, or just about everybody. So all of our students, faculty, and staff went home in March, and the rest of the spring semester was completed remotely online for all of our courses. I'm very pleased with how that went, given the abruptness of the change that we had to make, but we are done with that now. And here in the summer, we're really trying to get a jump start on the fall in several different ways. I'll just mention one right now, which is something novel that the college has done for our students, and that is give every student, every current student, as well as those new students who will be joining us in the fall, an opportunity to take a free full credit bearing course this summer online from one of our faculty so that they can get that credit ahead and sort of be be prepared for the fall with a little bit behind them that they otherwise wouldn't have had. It's an initiative that our students have really appreciated, and hundreds of them have taken advantage of that this summer in the online summer sessions that we're offering. But as we look to the fall, all of our planning is directed toward being back on campus. And I want to be clear about that. That doesn't mean for everybody. There will certainly be faculty and staff and students who are at risk in a variety of ways who will remain home. Some courses will be taught by those faculty online for students either on campus or in their homes. And that will continue at least through the fall and after if need be. But for the majority of our students, again, our planning is directed toward getting them back on campus, which they very deeply want. They're expressing to us every day. And so with that in mind, what are priorities? Well, the first, of course, is to make sure that everybody on campus, student, faculty, staff member, is safe. And we're doing a lot of planning to sort of prepare for that. But I'll just add quickly a second priority, which is, again, just to note the environment that we are now in. And thanks, Mayor Pantaleone and President O'Hara, for your words of support for peaceful protest that you offered at the beginning of this session following the horrific events in Minnesota a week ago. All of those are weighing deeply on our students. And so a second priority for us as they come back is to make sure that our students, all of them, especially our students of color, feel welcome, safe, and embraced on campus. And we're doing a lot of planning in that regard as well. But back to COVID, what are we looking at? We're going to alter our calendar, I think almost certainly. So everybody goes home before Thanksgiving. And there is something approaching a 2-month break between Thanksgiving and the start of second semester at the beginning of February. We're going to have a full testing, contact tracing, and self-isolation regimen on campus so that we test everybody, not just once, but repeatedly if necessary. We do contact tracing in a way that we're preparing for now, and again, have facilities to make it possible for self-isolation when it's necessary. We're lowering the density in our residence halls. The majority of our students will be living on campus, will be in single rooms. We're looking at dining hall shifts, again, to maintain the distance between people that Dr. Coben has talked about so well. We're lowering the occupancy limits for classrooms and other spaces on campus. And finally, I'll just note that our faculty are working very hard on preparing for pivots if they need to make those pivots during the fall or thereafter. So if they're starting to teach on campus, again, as we plan, but need to make a quick pivot to go online, that they're able to do that and prepared to do that well. Because we need to be open and ready and prepared for whatever realities are presented to us, certainly this fall and thereafter. It's going to be a different fall. The experience is going to be very different for all of us, certainly for our students, with the conditions that we'll need to impose. But I'm very optimistic and confident that we're going to be able to do this and do it well. And I frankly look forward to the experience. I think it's going to be a very interesting time for all of us. So
Thank you. Thank you.
Thank you, Steve. And again, another sort of little known fact about Lake Forest and Lake Bluff, but we're a college town. So there are lots of great aspects of the college being part of our community that really enriches the experience of living here. And I am going to make one little offhanded comment because it hasn't come up in our questions, but it was touched on in the form of car sales. Car sales have been a little flat. Home sales have been very good. And there is a very strong level of optimism in our real estate community for the future as one unpleasant urban experience after another seems to be accelerating people's life plans to provide space, clear air, and great schools for their families, and great hospitals and great colleges if they want to stay here from cradle to grave. So next question from a resident. Now we're going to move into the school system. What are elementary, middle, and high school going to look like in the fall, and when will decisions be made? What types of safety measures are being considered, including for those with underlying conditions? Mike and Jean, would you like to comment on that?
I should probably defer to my outgoing and elder colleague first on that one.
You're muted.
All right, can you hear me now?
Yes.
Thank you, Mr. Summick, my only 6 months younger colleague. We actually have been doing quite a few things preparing for the fall. Our new superintendent, Dr. Liali, has formed a task force made up of parents, teachers, other staff, nurses, and administrators, and they will be reviewing the surveys that were just sent out, which will provide a great foundation. We are already purchasing PPE and looking at our classrooms and really looking at the layout of our classrooms to figure out how we can accommodate as many students as we can safely. And then finally, because we are a school district, we are also looking at assessments to figure out exactly where kids are and make some plans in moving forward. So lots going on, lots of transition beginning July 1st, but I want to reassure everyone that Dr. Liali is doing the same work in Kenilworth. She's wonderful, and she's been working a lot with me lately. So thank you very much. And now I'll defer to my 6 month younger colleague, Mike.
Thank you, Jean. And I don't say this to her often because I don't want to give her a fat head, but Jean has really been a fabulous colleague, and I wish you well in your very richly deserved retirement. You've been a great and honorable public servant, Jean. Also, before I begin my comments, I'd also like to say thank you to Tom McAfee and Dr. Copen. One of the things that has astonished me throughout the past 3 months is the degree to which Tom has made himself available to each of us, and it's obvious why he holds Dr. Copen in such high esteem. He's always been available for us, not just during our weekly calls, but also intermittently, probably with all of us for any number of different inquiries that we've had during the course of this pandemic. So thank you very much, Tom and Dr. Copen, for all of your efforts, and we are incredibly proud to be your colleagues. So for the District 67 and for the high school plans going forward, we plan on reopening our schools in the fall if the state allows us to do so. Let me say that again, our preferred option is to have in-person instruction for kids in the fall. We have surveyed our parents and our staff about returning to school, and I can tell you that both our staff and our parents are very tightly aligned on the importance of in-person instruction for our kids. Some of the questions that we've received have asked why I am keeping our schools closed. I also need to make clear that the opening of schools in this case is the governor's call. If the governor says we are closed, we're closed, and local school superintendents don't have latitude to do otherwise on that. Our first priority for our students and our staff is safety. We also want to be clear that we cannot eliminate all risk for our students and our staff as well. We're going to continue to follow guidance from the state and local authorities on how to reopen and operate our schools safely. That means guidance from the governor's office, from the State Board of Ed, from the Illinois or Lake County departments of public health, and locally, we are going to continue to inquire and receive guidance from our local hospital, which has been so incredibly helpful again. Right now, we're awaiting guidance from the state. That is a really important factor. We've heard that we might be receiving guidance shortly. After we receive that guidance, we'll align the plans that we've been creating with that. We've been formulating those for some time. Those plans include 3 approaches that will vary at the elementary, middle, and high school levels in all likelihood. Fall is over 2 months away, so a lot can change between now and then. Think of how different life was just 3 months ago. But they will likely look something like this. Scenario 1, we'll assume that we're in phase 5 of the governor's plan, that society is fully reopened and we, like society, are on a regular and daily school with ongoing health and safety measures. Given the information that we're receiving, we think that is highly unlikely at this time. That is one of our scenarios, however. Scenario 2, we'll assume that we're in phase 2 or 3 and that we'll remain in a fully remote learning environment, similar to the experience that we've had since March 13th. We think that it is very unlikely that we will be in that scenario, and we obviously hope not to be. Scenario 3 assumes that we are in phase 4 and will reopen with a blended schedule of some kind, which will vary by grade level. We hear at this point in time that that is the most likely scenario for August, but this will change depending on the guidance that we receive from the CDC, from the Illinois Department of Public Health, or from the State Board of Ed. We continue to listen to our stakeholders very carefully. We've surveyed our parents twice now. We've also conducted focus groups with our parent leaders separately, K4, 5, 8, and 9, 12. These are pulse surveys for us. We've got survey data back from our students as well. We'll announce the menu of options that we have as soon as we can. They'll be more dialed in than what I briefly provided for you. And then sometime in late July or early August, we will select a path that we anticipate for the fall session for us. Also received questions about what might be guiding some of our decision making. We receive and we anticipate, in this case, guidance from the state on at least 3 critical areas for us. 1, how to address students that may not be able to attend in-person school in the fall. 2nd, how to address staff with those same concerns. And finally, how best do we protect our students and staff as they return to our buildings? For example, should students and staff wear masks? Should students and staff have their temperatures taken before entry? What sports and extracurriculars will be permitted? And guidance on how to determine that participation and those offerings. So we are waiting for guidance from the state, but we're also really active in looking at what European schools are doing as they reopen. A number of connections there have afforded us the ability to get information about the struggles that they're having, the successes that they're having as well. Comes down to several common themes. Logistics. Young children are particularly challenging to teach in an online setting, and students with specific learning needs. Those are really, really difficult challenges for every school district across the world at this point. So we'll continue to do research on that throughout the summer and fall.
Okay, Mike, glad you mentioned sports, because the next question says, has the IHSA weighed in on fall sports yet? Summer practices and competition. And this is for you and Jean.
Jean, would you like to go first on that?
We still have not heard anything from the governing board, the state governing board that deals with middle school. I don't predict that we will hear from them until most likely the end of July. The guidance that Mike was discussing from the Illinois State Board of Education may have information for our middle schools on that. Mike, I'm going to turn it over to you, because sports at the high school are a lot more important than the middle school.
Well, I think that kids being involved in athletics across their entire school experience is a really important thing, and so don't want to discount what activities kids have in middle school. We hear a lot more about what happens in high school. As Jean mentioned, we have not yet heard definitively from IHSA. We've heard from individuals within the IHSA, that's the High School Athletic Association. We are awaiting guidance from them. It is very important that the IHSA guidance align with the governor's 5-phase plan and with the Illinois Department of Public Health. That's one of the things we're going to be paying very close attention to. So as of yet, we have not heard definitively from them.
Thank you.
Next question is about online learning and what's being done to improve the quality and impact of online learning going forward.
I'll start with that, Mike. One of the things, as I shared, is the teachers from all of the grade levels really did an assessment of all the things that they wanted to get through and the standards for this grade level. And then all the things that they actually did and did not get through. And that will be articulated at the very beginning of the school year and over the summer. The other things that we're working on in Lake Bluff is the teachers are having some professional development, again, on online learning. We're going to learn a lot from the remote learning surveys that the results on that will be in next week, and that will be turned over to Dr. Leali and her team. And then finally, right now we're looking into assessments that would start at the beginning of the school year to find out exactly where kids are and help guide us getting them where they need to be. Mike?
For us, we will spend the summer revising and recreating our e-learning practices. Before I get into too many details on that, I really want to say thank you to all of our teachers, our staff, our administrators. They built an airplane while flying it this spring. It was a Herculean task, and I'm not just pleased, but I think like the overwhelming majority of our parents, I'm really proud of our teachers. I also would be remiss if I didn't say that e-learning is incredibly hard for our parents and for many of our kids. The younger they are, the more challenging it is. And also for our staff. Really long hours, really taxing. There are things that we would absolutely anticipate doing differently if we had opportunity to create that from whole cloth instead of on the fly, which is what the summer is going to afford us to do. With our a couple of the three key, some of the key themes I would say from parents and staff. Again, K2 is incredibly challenging. It's hard on staff. It's really hard on parents who don't have the pedagogical training that many of our staff bring, that all of our staff bring to such a challenge. Overwhelming sentiment is that there's a need for online connection on an ongoing basis, and that be structured. The face-to-face, the opportunity to see and hear teachers is critically important for everybody. Our staff say the same thing. A need for consistency, predictability, a schedule, and also a large dose of trying to figure out how to balance the rigor with the social and emotional needs that kids have, because not infrequently, it's hard to be separated from your friends. It's hard to be, this pandemic has been a real challenge for many kids and for their families. There are times when there's, great economic strain within a family and so on. And so the need for empathy and compassion with that. Our professional development over the summer is going to focus on relationship building from a distance, and then maintaining that. Also lesson planning and assessment in a virtual environment. We hope that we don't have to utilize anywhere near as much of this going forward as we have over the past several months, but we certainly want to be prepared for the possibility that might occur. And we also feel that we're going to learn a good deal from the past several months that we'll be able to apply to all instruction going forward. So there are actual silver linings in all of the challenges that we've faced over the past 3 months of e-learning. So we look forward to evolving what we're doing and changing it and creating more structure and paying attention to the feedback that we've gotten from our stakeholders.
Thank you, Mike. Will summer school programs in Lake Bluff and Lake Forest be offered in person or online this year? Or will
Well, summer school program, our ESY program is actually being offered with Lake Bluff and Lake Forest working together. And the only other thing that Lake Bluff will be doing is they're looking right now into providing a 2-week jumpstart program in August that would be for all kids. Mike.
Our summer program, extended school year and otherwise, is all online, both at the middle school and the high school.
George, you have a, take that last question?
That actually, that's a question that was going to be handled offline. So actually the last question was the last question.
Was that the last question? Okay.
So
I didn't know that at the
at
end.
this point,
Okay.
we can start to wrap up. This has been, I think, quite helpful. We really appreciate the time that this group of people who normally can't get together has devoted to this community forum about moving forward from the COVID lockdown. Gene, I didn't know you were retiring. I guess I don't have school-age children, so I was out of the loop on that, but congratulations and have a wonderful, long and healthy retirement. And Kathy, any final words you'd like to say?
Yes. First of all, I'd like to thank Lake Forest for hosting this event. And I too, George, also found this extremely informative. I really think that certainly what this last hour or so has shown is the extent of the cooperation and communication between the communities and between all the entities that make up these communities, and how important it is as we move forward. And we are moving forward, following the governor's guidelines. We are trying to balance up between reopening our businesses and our other economic stimulus, and also to maintain, as Dr. Copeland has so strongly stated, the health and safety that we need to maintain as we move ahead in this. Thank you all so very, very much for participating and bringing your expertise and wisdom to us tonight.
Yeah, so with that, I'd just like to again say thanks to Michael Simic, Superintendent of Lake Forest Schools, Jean Sophie, Superintendent of Lake Bluff Middle School, Irvin, Village Administrator of Lake Bluff, Jason Wisha, City Manager of Lake Forest, Steve Scott, President of Lake Forest College, and Tom McAfee, President, and Jeffrey Copen, Senior Vice President, Chief Medical Officer of Lake Forest Hospital. Thank you all very much. Thank you to all of our neighbors who have been watching. I'm told there were on the level of 300 people that were watching out there tonight, which is great. And I think we'll probably have to do this again. Thanks to the technical team that put it together. And everybody enjoy the summer.
Yes, please do. Thank you.